Good day everyone, I'm Alexander James Y. Palad. So for today, I'm going to show you the proper procedure of the EINC or the Essential Intrapartum and Newborn Care Practice. So for the purpose of this assessment is to provide a safe and quality nursing care of birthing mother and their newborn. So it is also to practice the recommended practices during antepartum, intrapartum, and immediate postpartum period. It is also to follow the recommended practices in newborn care. Okay, so for the materials that we're going to use, we have decontamination solution, Callis forceps, Mayo Caesar, sterile gauze, cotton balls, sterile gloves, and we have also syringes. We have weighing scale, dummies, tape measure, pail. We have also calipad, umbilical cord clamp, baby's blanket, baby's towel, and also we have baby dress and underpad. We have also the vitamin K, BCG, and Hepa B vaccines, and we have also a plaster. So for the procedure in advance, we need to prepare a decontamination solution by mixing 1 part of 5% chlorine bleach to a 9 part of water to make a 0.5 chlorine solution. So I have here a 0.5 chlorine solution. So change chlorine solution at the beginning of each day, whatever solution is very contaminated or cloudy. So prior to woman's transfer to the DR or delivery room, ensure that the woman is in her position of choice while in labor. Then ask the woman if she wishes to eat, drink, or void. And also communicate to the mother if informed her of progress of labor, then give assurance and encouragement. So ma'am, comfortable ko ba kayo sa position niyo po ngayon? Baka gusto niyo pong umihi, kumain, or uminom po? Okay. So a woman in the delivery room, so prepare for the delivery. First, we need to check the room temperature if it is in 25 to 28 degrees Celsius. Then, eliminate the air draft. Then, after that, we're going to ask the mother if she is comfortable with the semi-upright position or the default position on the delivery table. So, ma'am, are you comfortable with the semi-upright position? Okay. Then, after asking the woman, we're going to ensure the privacy by closing the door, closing the window, and closing also the curtains. Then after that, we're going to remove all the jewelries and wash hands thoroughly and while observing the WHO 1, 2, 3, 4, 5 procedure. So let's assume that I already washed my hands. I already performed a infectious control procedure. So it is safe now to proceed to our next procedure. Then, we're going to prepare a clear and a clean newborn resuscitation area. Check the equipment if it is clean, functional, and if it is within easy reach. Then, arrange the materials in a linear sequence. So, I have here a gloves, a dry linen, a bonnet, a oxytocin injection, a plastic clamp, a instrument clamp, and also I have a scissor and kidney basin. So, in a separate sequence, for after the first breastfeed, I have eye ointment, and also I have vitamin K, BCG vaccine, and also I have Hepa V vaccine, and also I have a cotton balls here. So next, clean the perineum using antiseptic solution. So ma'am, I'm going to clean your perineum. Is it okay with you, ma'am? Okay, so I'm going to... So we're going to use this antiseptic solution and a sterile gauze. Then, after cleaning the perineum, we're going to discard it in a proper receptacle. Then, wash our hands and put it on a 2 pairs of gloves aseptically if same person holding the perineum and the cord. So I'm going to wash my hands, and I'm going to put my 2 pairs of gloves. So at the time of delivery, so first we need to encourage the woman to push us this side. So ma'am, umiri lang po kayo pag nararamdaman yung lumalabas na si baby, ha? Then drape clean dry linen over the mother's abdomen or chest in preparation for the drying of the baby. So we're going to use this dry linen. Then apply a perineal support and did control the delivery of the head. Then if the baby is already delivered, call out the time of birth and the sex of the baby and inform to mother of outcome. So time of birth po is 10:54 and it is baby girl po, mother. Okay, so for the first 30 seconds, we need to thoroughly dry the baby for at least 30 seconds. We start from the face and the head. Then going down to the trunk and to the lower extremities while performing a quick check for breathing. So for the first 1 to 3 minutes, we're going to remove now the wet cloth and place the baby in skin-to-skin contact with her mother over the abdomen. So I'm going to remove this. Then I'm going to place it here. And I'm going to place the baby with a prone position. Then after that, we're going to cover the baby with a dry and clean cloth, and also the baby's head use a bonnet. Okay. Then after covering the baby, we're going to exclude a second baby by palpating the abdomen of the mother. So ma'am, I'm going to palpate your abdomen. So after that, there are no presence of second baby. So we need to use a wet cloth to wipe the soiled gloves and give the IM oxytocin at least the first minute of the baby's birth. Then dispose the wet cloth properly. So here, I'm going to wipe the soiled gloves. Then we need to discard it on a correct receptacle. Then, we're going to administer now the oxytocin. Ma'am, I'm going to administer now the oxytocin in your deltoid part. So, I'm going to administer it here. Okay. Then after that, we're going to discard the used syringe in the proper sharp container. Then after that, we're going to remove the first set of gloves, decontaminate them properly on 0.5% of chlorine solution, and decontaminate them for at least 10 minutes. Okay. Next, we're going to palpate the umbilical cord and check for pulsation. Okay, now we're going to place the baby here. Then after pulsation stop, clamp it using a plastic clamp and tie it 2 cm from the base. So we have a plastic clamp here. We're going to clamp it Then after that, we're going to clamp it again using instrument clamp for at least 5 cm from the base. Then after that, we're going to cut near plastic clamp and not midway. Okay, so I'm going to use this Mayo scissor. Then after cutting that, perform the remaining steps of AMTSL or the active management of the third stage of the labor. Cut me. So wait for the strong uterine contraction, then control the contraction and counter-traction of the uterus, then continuing until the placenta is delivered. Then when the placenta is delivered, massage the uterus until it's firm. Okay, so now we're going to inspect the lower vagina and the perineum if there's any presence of lacerations or tears. And if there's any presence of laceration or tears, we need to repair it as necessary. So, ma'am, I'm going to inspect your lower vagina and the perineum. So, upon inspection, there are no presence of laceration or tears. Then, we're going to examine the placenta for completeness and abnormalities. So, after checking the placenta, we're going to dispose it in a leak-proof container or plastic bag. So, I'm going to dispose it in a... So, after that, we're going to clean the mother, then flush the perineum, and apply a perineal pad or napkin and or other cloth. Okay, so I'm going to clean the perineum again. Then I'm going to apply a perineal pad. So after that, we're going to check the baby's color and the breathing. And also check the mother if she is comfortable and if the uterus is contracted. So the color and the breathing of the baby seems to be normal and there are no presence of any abnormal sounds. And the color of the baby, there are no presence of any skin discoloration. So after that, we're going to decontaminate or soak in a 5% or 0.5% of chlorine solution the instrument that we have been using this procedure, and we need to decontaminate also the second part of gloves before disposal. Then start that for at least 10 minutes. Okay. Okay, so advise the mother for feeding cues and side examples of feeding cues. So mother, we need to observe po pag nagugutom na si baby. So example po na nagugutom si baby is pag inaabot na po yung breast nyo. Then instruct also the mother in her position and attachment. So mother, pag pinapadedi po si baby, we need to support po. Okay, so kailangan po mag-side po kayo ng konti at make sure po na hindi po matatakpan yung ilong ni baby pag pinapadedi nyo po siya. Then, wait for the full breastfeed to be completed. Then, if the breastfeed is already completed, administer the eye ointment. Okay, so since the breastfeed is already completed, we're going now to administer the eye ointment. So make sure that you administer the eye ointment. It should be from inner canthus to outer canthus. So next, we're going to do thorough physical examination. So the physical examination included for the baby is the cephalocaudal from head to toe, and the apgar or the appearance, pulse, grimace, activity, and the respiration of the baby. So now using tape measure, we're going to measure the head size of the baby. So the size of the head of the baby is 33, which is normal because the normal cephalic size of the baby is 33 to 35 centimeters. Then next, we're going to get the size of the abdomen or the circumference of the abdomen. Okay, so it is 31, which is normal because the normal size of baby's abdomen is 30 to 33. Then we're going to get the size of the baby's chest. So 31 also, and it is normal because the normal size of the chest of the baby is 30 to 33 cm. So upon checking also the respiration and the appearance of the baby, there are no presence of discoloration, and the respiration of the baby, there are no presence of any abnormal sounds. So upon checking the physical examination of the baby, there are no presence of any abnormality. So upon physical examination, the baby is perfectly normal. Now, we're going to administer the vitamin K, Hepa B, and the BCG vaccines. So first, we need to administer the BCG vaccine on the deltoid part of the baby. So, the purpose of this BCG vaccine is to prevent from having tuberculosis of the baby. Then, the vitamin K for the vastus lateralis part of the baby. Then, administer it 90 degrees. The purpose of vitamin K is to prevent from having vitamin K deficiency of the baby. Then the last is the Hepa B on the other leg. Then the purpose of Hepa B is to prevent from having hepatitis of the baby. So we need to advise optional or delayed bathing of the baby. We need also to advise to the mother the breastfeeding per demand. So mother, hindi po natin pwedeng laging pinapadedi si baby every minute. Pag lang po pag na-observean nyo na po meron ng feeding cues, doon nyo po siya padidein. Okay, so in the first hour, we need to check the breathing and the color of the baby. We need also to check for the vital signs of the mother and massage the uterus for every 15 minutes. On the second hour, we need to check the mother and the baby diet for every 30 minutes to 1 hour. Then complete the records.